Hi, this is Dr. Jen, fertility friend, here for your fertility tip. And I want to talk to you today about IVF for same-sex female couples. Fertility treatment for women who are same-sex couples is different than a heterosexual couple who's been trying to get pregnant and hasn't gotten pregnant because they don't have the same fertility issues. Sometimes they don't have fertility issues at all, but we do need to do IVF in these couples for a few reasons. Sometimes they've tried donor sperm insemination and haven't gotten pregnant, so that's one reason. A second reason might be that they have age-related fertility issues. So even though they haven't been trying to get pregnant on their own, once they're getting to age 40 or older, impact of age on fertility becomes so great that we need to move to IVF because of this age-related infertility. And a third reason that same-sex couples may want to do IVF is that one of the women may want to grow the eggs and harvest them so that her partner can carry the pregnancy. So they're her eggs, but her partner is carrying the pregnancy. So that would be a third reason we may want to do IVF for same-sex couples. How does the IVF work? So I find a lot of time for same-sex couples, because they don't have the same fertility issues as heterosexual couples, that we can use gentler protocols, and we're able to get a nice group of eggs to grow with these gentler medication protocols because they don't have the same underlying fertility issues. So we're able to use some of our Mini-IVF and natural hormone cycles with fewer injections, and they work really well. For women who are doing reciprocal IVF, where one woman is growing and harvesting the eggs and the other woman is carrying the pregnancy, we need to do two different types of evaluation. So for the woman going to harvest the eggs, we need to check her egg reserve and her hormone levels, that check egg reserve, and ultrasound to look at her egg count. And for the woman who's going to be carrying the pregnancy, we don't worry so much about the ovaries, but we really want to check carefully her uterus and do an ultrasound to check the shape of the uterus, and do a specialized ultrasound called the water ultrasound so we can make sure the inside of the uterus looks good to carry a baby. So the evaluations are different for each woman. Feel free to call me, contact me. I can get you on your way. I've had so many successes in working with same-sex couples. I just had a video chat today with a couple who has a little baby, 8 months old, so cute. And they work with me through a few fertility treatments and now have this little baby, and they're both so thrilled and so happy to be mothers. So I'd love to help you too. So call, email, you can DM me on Instagram at Dr. Jen Fertility Friend, and I'll get back to you and we'll get you started on your journey.